Welcome back to Houston Life. Okay, so Houstonians, you know, we are all very resilient people. We've been through a lot of weather events, but sometimes when it comes to freezing temperatures, we still have a lot of questions, right?
Absolutely. And over the next few days, we're going to want to pay attention to our bodies that are working overtime to make sure we stay warm. They're usually doing the opposite, right, in the summer. So here to explain more, Dr. Hilary Fairbrother, who is an emergency medicine physician at UTHealth Houston. Welcome to our show, Dr. Hilary.
Thanks so much for having me.
So let's just talk about hypothermia. Let's explain what that is to our viewers.
So hypothermia is literally when your environment is too cold and your body just can't keep up and the body's temperature starts dropping. We are pretty intolerant as human beings to changes in our body's temperature. Just a few degrees too hot, we get a fever, and just a few degrees too cold, we start getting hypothermic. So our body has self-defense mechanisms, but when they get overwhelmed or when it's just too cold for too long, then we see patients unfortunately start to suffer from hypothermia.
And Dr. Fairbrother, is it true that, I know we're all chatting about freezing temperatures and what happens to our pipes and all of that, but hypothermia, is it true it can happen at temperatures as low as just 40 degrees?
So yes, unfortunately, patients can get hypothermic even if it's not below freezing. So even in temperatures as warm as 40 degrees. And we see this with different groups of people that might have trouble getting out of the cold. And we also see this when people's clothes or their skin gets wet or damp, either from sweat or from the rain or from some sort of moisture source. When people have moisture on their skin and clothes, even at temperatures warmer than freezing, hypothermia can be a problem.
You know, we always hear people talk about here it being so humid because it's, you know, it's the humidity here, but we have very much a non-dry heat, right? That moisture is constantly being absorbed, which is why it's so important to protect our extremities. But there's a difference, right? There's a difference between getting frostbite and hypothermia. Can you explain that?
Sure. So frostbite is when usually it's your fingers and your toes or your ears, parts of our body that are very far away from our heart that may not have the best of blood flow. And when we get cold, if we don't protect, you know, with gloves, with nice warm socks or really nice warm shoes, which frankly, living in Houston, you very well might not own. So with the appropriate external attire to protect our ears, our fingers, and our toes, it is possible for those parts of our body that are far away from our heart with poor blood flow to really get too cold and to get injured by the cold without our whole body being cold. Hypothermia is when our whole body, including like the inside of our body and our brain, is getting cold.
And Dr. Fairbrother, one of those first signs may be shivering, right, when we're getting cold. But here's a whole list of symptoms we're seeing on the screen that could indicate someone is experiencing hypothermia.
Yeah, so I always tell people the first thing that happens when we're getting too cold is our brain, we tell ourselves we feel cold and we start to shiver. And shivering is a great self-defense mechanism. When we shiver, all of our muscles are contracting and we are generating heat. And so this helps keep our body warm once our body temperature starts falling, and it helps prevent hypothermia. But like anything else, if we can't get inside, if we can't get dry, if we can't get warm, then the body's self-defense mechanisms will eventually be overwhelmed and a patient will actually stop shivering and can really start experiencing some of those other kind of brain problems with the confusion and slurred speech and even being unconscious. We see patients be unconscious when they really get too cold.
Right. And this is a topic I think Texans should just know. We should be reiterating this because it's not, you know, in our common knowledge wheelhouse. Real quickly, we're almost out of time. What should someone do if they suspect that someone has hypothermia? They're seeing those warning signs we talked about.
So if you really think that someone's experiencing hypothermia, especially let's say you're walking your dog, you see someone outside, especially someone vulnerable. So we think of the very young, the very old, our homeless population, anyone who seems confused outside, etc., then you should call 911 because this is a medical emergency and we really do want these patients and these people to be brought inside and warmed up quickly. in a responsible way. It's not always so easy. There are cardiac and heart problems that can happen with rewarming. If the worst case scenario, if you came across someone that you think is very cold and they appear dead and they don't have a pulse, you should call 911 and start CPR.
My goodness, so important. Dr. Hilary Fairbrother, thank you so much. UT Health. We will, by the way, be posting a link with more information on our website, HoustonLife.tv.